good afternoon.
Hi.
My name is Joanna Tovar. I'm a Be the Nurse Practitioner student that's going to be interviewing you today. Is it okay if I use this interview and upload it online?
Yes, it is.
Okay. I'm going to take a seat here. We're going to be doing a health history today, and I'm going to be asking you a couple of questions. Some of these questions are going to be a little intimidating and a little invasive, but it's important for me to obtain a thorough history. If for any reason you have any questions or if you need some further explanation, just let me know, okay?
Okay, thank you.
Okay. So starting off, what's your name?
My name is Lucy Lopez.
Okay. Nice to meet you, Lucy. What's your date of birth?
It is August 24th, 1990.
Okay. And what ethnicity are you?
I am Mexican.
Okay. And have you been married? Are you single? Divorced?
No, I'm single.
Okay. And who did you come with today?
Today I came with a friend.
A friend? Okay. And what do you do for a living?
I am a second grade school teacher.
Wow. That must be very intense dealing with 7-year-olds. So what brings you in today?
I'm here for a wellness check.
Okay. Just a regular physical exam, or is it for something specific?
No, it's for self wellness.
Okay. Okay. So what medical problems do you have?
Currently, none. I've never been diagnosed with anything.
Okay. Have you had any surgeries previously?
I had LASIK eye surgery.
LASIK eye surgery? How long ago was that?
That was when I was 24 years old.
Okay.
So about 5 years ago.
Okay. And have you ever been admitted to a hospital for any like any other illnesses or major illnesses?
No.
Okay. And you said you didn't have any, well, besides the LASIK, no other surgeries, correct?
No other surgeries.
Okay. When was your last dental exam?
It was probably 6 months ago. So that was like in April or so?
Okay, April
of 2019.
Okay. And for do you have any allergies?
None.
Do you have any allergies to dust or
No.
seasonal allergies?
No.
Any allergies to animals, dogs, cats, birds?
No, I actually have a dog.
Okay. Do you have any allergies to latex?
No.
Any food allergies?
None.
Okay. And do you take any medications?
No, none.
No medications? How about over-the-counter medications? Anything?
No.
No? You usually don't need any medicine for...
No, I mean, unless I have like a headache or something, I'll take a Tylenol, but that's very, very rare.
Okay. And when you were a child, did you have any like illnesses, major illnesses that you can remember?
I did have the chicken pox when I was 5 years old.
Okay. And are you up to date with all of your immunizations?
Yes, being around kids, I have to be.
Good. Have you received your flu shot?
Yes, we did at the beginning of October of this year.
That's good. So the 2019 August?
Of October.
Of October.
Yes.
Okay. Sorry about that.
Mm-hmm.
Okay. So now we're going to be getting in a little more personal with your family history.
Okay.
What medical problems does your mother have?
My mother has hypertension.
And is she still alive?
Yes, she is. She is 58 years old.
Okay. And how about your father?
My father, he is actually 59 years old, and he has glaucoma.
Oh, glaucoma. Okay. And with your mother's side of the family, with your maternal grandmother, is she still alive?
No, my maternal grandmother passed at 72.
Okay.
She had history of hypertension and congestive heart failure, I think is what it's called.
Okay.
And she passed from that.
Oh, from the congestive heart failure. I'm sorry for your loss.
Oh, thank you.
For your maternal grandfather, is he still alive?
He is still alive. He is 85.
Okay.
And he does have diabetes.
Diabetes, okay. And how about your paternal grandmother?
My paternal grandmother, she is not alive.
Mm-hmm.
She passed when she was 62 from stomach cancer.
Okay. And how about your paternal grandfather?
My paternal grandfather is not alive.
Mm-hmm.
He passed 2 years ago, so he was like 78, I think.
Mm-hmm.
And he passed from a heart attack.
A heart attack.
Yes.
Okay. So cancer, and you have cancer history in your family.
From my paternal grandmother, yes.
Do you have any siblings?
I have one sister.
One sister. And how old is she?
My sister is 25.
25. And does she have any medical problems?
None.
Okay. For like drinking, smoking, do you smoke?
I do not smoke, no.
No vaping?
No.
No e-cigarettes?
No.
No chewing tobacco? No. Do you drink occasionally, or do you have?
I'll have an occasional drink when we go to dinner on Fridays. I'll have one glass of red wine.
Okay. And it's just on Fridays that you drink?
Yes.
Okay. And do you are you using any illicit drugs?
No.
No weed, cocaine?
No, none.
Okay. For diet, how is your diet?
My diet is it's fairly healthy. I will have the occasional bad meal on a Friday.
Mm-hmm.
During the week, though, I pack my lunch for work, so it'll consist of a salad or some type of leftover from the previous night, rice and veggies with chicken, things like that sort.
How often do you have meals? Like, what would you say?
I'm pretty on the regular 3 meal a day schedule. I'll have for breakfast. I'll have a protein shake or something fast, because I have to get to the kids. Or oatmeal, and then I'll have my lunch, and at home my dinner. And I'll have a snack, like when it's snack time for the kids.
Okay.
Yeah, I'll have some peanut butter and celery and things like that.
And when you said sometimes you do skip a meal. Is that on the regular, or is it?
No, it just depends if I have a busy lunch hour.
Okay.
Grading stuff, but that's not very regular.
Okay. When was the last time you had to skip a meal?
That was probably when we were having parent-teacher conferences.
Okay.
2 months ago.
Must be very busy with all the kids.
Yes, it
is. I appreciate all you do for the children.
Thank you.
Do you do any exercise?
Yes, I do. It's a must when you're
running around all the kids,
yes.
Right?
Yes.
Do you exercise at home or at the gym?
I'll go to our local gym, and I'll take in a 30-minute workout class.
Okay. How often do you do that?
I try to do it at least 4 times a week.
4 times a week. Okay. And you said you do classes. For any of that, do you do any supplements, or do you take any medicate herbal or pre-workout for the gym or anything like that? Okay. Do you drink any caffeine?
Yes.
How much caffeine do you drink?
I have a cup of coffee every day.
A cup of coffee every day? Okay. Do you drink any sodas? Or? No. Okay. So just a coffee every morning.
Mm-hmm.
Okay. And I did forget to mention the past medical history. Do you do any herbal supplements, or do you do anything herbal or supplements?
No.
No? Okay. So now we're going to be going to the more intimate, as you can see. I'm going to be asking about your reproductive health. So did you mention what was your last pap smear?
My last pap smear was in June of 2019.
June of 2019, okay. And are you on any contraception right now?
I am currently using the IUD.
IUD, okay.
Yes.
And when did you have that placed?
That was placed in 2 years ago.
2 years ago?
2017.
Okay. And have you ever been pregnant?
No.
You don't have had any miscarriages or anything like that? Do you have a history of, or have you ever had a sexually transmitted infection?
No.
No? Okay. Are you currently in a relationship with someone? Or?
Yes.
Yes. Is it just with that person, or do you have multiple sexual partners?
No, it's a monogamous relationship.
Okay. And what do you identify yourself as?
I'm heterosexual.
Heterosexual?
Mm-hmm.
Okay. And you already mentioned that you work as a school teacher. You said, are you not married? You're not living with your significant other?
No.
No. Are you? Who do you live with?
I live on my own and my dog.
On your dog. Okay. Do you have a preferred religion or spirituality? What do you consider yourself?
I was raised a Catholic, so I'm a Catholic.
Okay.
I attend church. I try to go every Sunday.
Every Sunday. Okay. And then just safety. Do you use a seatbelt?
Yes.
Yes. Okay. Do you text and drive?
No. I've seen terrible accidents because of it. So.
Okay. And do you own a gun?
No.
Okay. Do you have issues with the children? I'm assuming it could be a very stressful job. So do you have any issues dealing with stress, or how do you usually deal with your stress?
With stress, I mean, going to the gym. That's why it's a must after work.
Mm-hmm.
That's probably it, and watching some Netflix afterwards.
To help relax, right? Have some alone time.
Yes.
Okay, so for now we're going to be getting into the more detailed portion of your history. So we're going to be doing what's called the review of systems. I'm going to be asking you a lot of questions. Most of the questions are yes and no answers, but there is some. I mean, if you feel the need to elaborate, go ahead. Don't let me stop you. Okay. So we're going to start. Are you having any fevers recently?
No.
Are you having any chills?
No.
Any body pain?
No.
Any malaise?
No.
Okay. Have you had any change in vision?
No.
No blurred vision?
No.
No double vision?
No.
Do you use glasses?
Not anymore after that LASIK.
Okay. So when was your last eye exam?
It was in February of this year.
February of this year. Okay. And you don't have any problems with LASIK? You see?
No. After the surgery, my vision is pretty much 20/20.
Okay. Have you been having any ear pain?
No.
Have you having any ringing in your ears?
None.
No. How about any nasal congestion?
No.
Nosebleeds?
No. None.
No. Any sore throat?
No.
Any difficulty swallowing?
No.
No. Okay. How about any chest pain?
None.
You haven't had any chest pain. How about any palpitations?
No.
Have you ever been told you had like a murmur or an arrhythmia?
No.
Okay. When was the last time you had any KG, or have you had one done before?
I had one done last year, just part of my physical.
Okay.
Last year, and it was negative. They said everything was fine.
Okay. Have you had any high blood pressure or incidents where they've taken your blood pressure and it's high?
No, it's been pretty normal.
Okay. And have you had any shortness of breath or trouble breathing?
No.
Okay. How about any wheezing or
None.
any cough?
No.
Okay. Have you had any nausea with your upset stomach?
No.
No. Vomiting?
No.
Diarrhea?
None.
How many times do you usually go to the restroom?
I have bowel movement pretty much once every day.
Once every day.
Mhm.
Okay. And it is not, you don't have difficulty like it's soft or
No.
like
Yeah, it's soft, normal,
Okay.
brown.
Okay. And have you had any pain with urination?
None.
Any urinary frequency?
No.
No. Okay. Have you had any blood in your urine?
No.
I don't know if I mentioned, but did you let me know your last menstrual period?
My last menstrual period, no, I'm sorry, I forgot to tell you. It was on, it just finished last week.
Last week.
Yeah,
Okay. And you're
last
still
Friday.
getting periods?
Yes, every month. I'm pretty regular.
Okay. So every month. Okay. And for now, we're going to be moving on to your musculoskeletal exam. Well, the review system part. So, are you having any joint pain?
No.
Or how about back pain?
No.
Stiffness, like back stiffness?
Mm-mm.
Nothing.
No.
Have you had any swelling in your joints?
No.
No. Okay. Have you had any that you've known, like any rashes in your skin?
No, my skin's pretty clear. Just my freckles.
Itching?
No.
No. And for your breast, do you do breast exam
I try to self-explore at least once a month.
once a month? And have you ever had any previous like breast lumps?
No.
Any like discharge coming from like your breast or
no.
nothing? When was your last of like breast exam, like official breast exam?
With my last pap smear.
With your last pap smear?
Yes.
Okay. And do you have any headaches?
No.
No? How about, have you had a history of seizures?
No, never.
Okay. How about numbness to your hands or to your feet?
No.
Tingling?
No, no tingling.
Okay.
Numbness.
Now for psychiatric, I'm just gonna be asking you a little personal questions, but have you ever had like any suicidal thoughts?
No, no
No.
suicidal
Okay.
ideation.
Do you have a history of anxiety?
No, I've been very calm person. So.
Okay. How about any sleep problems?
No, I sleep very well at the end of the night.
How long do you sleep usually? What constitutes?
I would say about 7 hours is my regular sleeping time.
Schedule?
Yeah.
And you feel well rested with that?
Yes.
Yeah. Do you nap in between or?
No.
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 I imagine to be pretty busy with it.
Yes.
Do you have you ever been told you've been anemic or do you have a history of anemia?
No.
Have you had any previous blood transfusions?
No blood transfusions really.
Okay. Have you been having an increased appetite?
No, my appetite is pretty regular. I get satiated with whatever I'm eating.
Okay.
Pretty satisfied with it.
Have you had any excessive sweating, like from besides being at the gym, just like that you're pouring sweat, like night
Oh,
sweats?
no.
Okay. Have you ever had thyroid problems that you
No.
know of? No? Okay. So for the allergic reaction you did, I mean, you said you had no allergies, but just to be a little more in depth, you don't have any more swelling of the lips, like no rashes or hives?
No rashes, hives, or my lips swelling.
Okay. So I think this pretty much concludes the health history of my exam. So I'm actually going to be stepping out of the room so we can get you dressed into a gown and continue on with the physical portion.
Okay.
The nurse will be coming in to assist you to change. If you have any other questions, I'll be back to answer them. Thank you so much for your time.
Thank you.